My name is Richard Harris. I'm a vascular and endovascular surgeon here at the Sydney Adventist Hospital. An endovascular surgeon is the evolution of what vascular surgery was. So vascular surgery was an enormous specialty that dealt with all arterial and venous disease and had to do major incisions to deal with that disease. Endovascular surgery has come through the marriage of the technology of X-ray and wire technology with the vascular disease. So vascular surgeons have learned the skills of dealing with vascular disease through minimally invasive techniques. And that includes putting stents in to block off flow into arterial aneurysms, to block off abnormal flows in veins that are behaving abnormally, to open veins that are blocked off with clot, deep vein thrombosis, and to open arteries that once had to be bypassed with massive operations, now with special devices that can clean out the artery inside the vessel itself, and just through a little tiny puncture in the groin. So this is using angiography, which is replacing or has replaced 99% of the time open surgery, which we learnt when we were young vascular surgeons. So angiography is the application of X-ray and contrast imaging to arteries and veins. So we can access an artery very carefully under ultrasound control and place a catheter within the vessels and release some contrast into that vessel, which then lights up on our angiographic X-ray machine. The X-ray machine is so clever that it can cut out everything else apart from the artery itself. So you don't see the bones or the other tissues, you just see the arteries. And so you can deal very specifically with those arteries. So one of the most exciting things being a vascular and endovascular surgeon over the years has been the introduction of technology, and it just comes in wave after wave after wave, and it's very exciting because every year we're seeing better techniques for dealing with things, and this is usually or very often evidence-based, and we're gradually improving on the results every year on technology after technology. So, for example, in the last 12 months where we were putting stents in blocked arteries in legs, we're now going back to cleaning out those arteries with a special device that spins around at 20,000 RPM and actually slices through the blocked vessel, slices through the atherosclerosis. And then we can deliver, and this is the new part, a drug via a balloon that stops the regrowth of that disease inside that artery. And so we can, rather than leaving a piece of metal, a stent inside the vessel to keep it open, we can actually leave the vessel as it was in its native form. And that will mean that the patient can go on with their own artery for many years without re-intervention.